Welcome. My name is Garth A. Fowler, and I'm the Associate Executive Director of the APA's Office of Graduate and Postgraduate Education and Training. And I will be your moderator today for our latest installment in our Psych IQ series on emerging careers. I'm excited today to be joined by my colleague Vail Wright, who is a licensed psychologist in the District of Columbia, and she's also the APA's Director of Research and Special Projects. And so today, Vail and I are going to talk about career opportunities for psychologists, plus areas, both new and old, where practitioners can really make a huge impact. So for a little, excuse me, for a little history, let's think about this. When I was a graduate student, many of my classmates had their sights on a health service psychology career, being a clinician or a counselor, and they wanted to work with patients every day. That is and continues to be a really common track for budding psychologists. But much has changed, and today there's a need for professional psychological help, greater than there ever was before. So it's important that we look beyond these traditional client settings, things that happen outside the therapy room, where we can actually have the greatest impact from our profession and help as many people as possible. So we hope this conversation today is going to help you on your way to kind of filling that need and building your career. I'm going to turn it over to Vail in a second here, but I want to remind you that you can submit questions throughout the talk using the questions section, and at the end we'll be able to vet some of those and ask them. And so now to get us started, I'm going to hand it over to Vail, who's going to give a presentation. So Vail, take it away.
Thanks so much for having me, Garth. I'm excited to be here. As a psychologist and as a researcher, I love numbers, and so I thought we could start by framing our discussion with a little bit talk about kind of what the scene is right now. Our nation's healthcare system has gone through a great deal of change in recent years. Thanks in part to the Affordable Care Act, nearly 81% of Americans with serious psychological distress, such as hopelessness and depression, had access to healthcare coverage in 2015. And yet, despite that increase in access, only 34.2% of people actually sought help from a mental health professional in 2015. While more research is needed to understand, what this gap is all about, there's clearly a need to get to the people that aren't getting the care that they need. Further, the importance of mental health is not lost on U.S. employers. In fact, 75% of U.S. employers say stress is their number one concern for their employees. So I think as psychologists, there's a real opportunity to serve the needs of the public and to reach out to those who need help but just aren't being reached. I think a lot of us were trained within a traditional therapy model, which Garth already alluded to, as kind of the primary way that we think about treating patients. But we really need to recognize that there are many ways psychologists can benefit patients outside of a traditional 50-minute session, and that a lot of the things we're going to be talking about today are ways that psychologists can be more proactive in reaching patients and clients, as opposed to just sort of sitting back and waiting for people to contact us. So within that vein, I want to talk about how psychologists, that we can utilize the full scope of our doctorate, close this mental health care gap that we're seeing, and also help those who might otherwise get overlooked. And trying to advance my slide. There we go. So I'm going to highlight 4 areas today. The first area for growth is going to be the healthcare sector. And let me start with just a really quick caveat. When I was thinking about this webinar and what I wanted to talk about and what were emerging areas for practice, it really dawned on me that psychology is already kind of everywhere, right? We have psychologists working with Cirque du Soleil, helping them with their performance. We have psychologists working with astronauts going, into outer space. So it's not that the areas I'm going to talk about today, psychologists aren't already working in. There are people that have come before us. But the 4 areas I want to highlight today, I think, are places where there's still room for growth. And so, for example, in healthcare, I think we have seen a bit of a shift where the healthcare system is increasingly recognizing the benefits of psychologists and what we can bring to patients, and that they want to find ways to incorporate us into the overall care continuum. And where we hear this happening the most right now is in the area of primary care integration. And APA has been providing members resources on how to take advantage of these primary care integration opportunities. But really, primary care is just one area of healthcare, and it's not just the only option. For example, there are a number of specialty health clinics around the country that may be looking for psychologists to join their organizations. I don't think it'll surprise anyone to think about the ways in which the psychologist can be a real benefit for those who are treating cancer and in cancer clinics. Yet, even at the Cleveland Clinic, a world-renowned premier hospital, they only just added a psychologist within the last 2 months to their clinic. So you can still see where there are lots of opportunities for psychologists to continue to grow and embed themselves in these different areas. I think some other examples here, fertility and OBGYN type services, for example, we know that 1 in 7 women who get pregnant will have postpartum depression. And so there's a lot of room, I think, there for the role of psychology to become more embedded. In fact, there was just an article in New York Times today about fertility and IVF and how the percentage for IVF after 40 is actually much lower than people think. And I see so many opportunities there for psychologists to help work with women who are trying to become pregnant or are unable to become pregnant, and then how you adjust to those changes in your life. Another area is obviously pain management, with the move towards and away from pain medications and the concerns about opiate addiction. Psychologists who are behavioral experts, there's a real role for them in this area. And then also with geriatric and aging populations, again, we're seeing the baby boomers get older. It's our largest growing population. There are not nearly enough psychologists or other health professionals that specialize in this population, and so I think that's another really huge growth area for psychologists to get into. So you can see that there are some real clear opportunities for psychologists to assume leadership roles in these areas, which could help them expand their services sort of outside sort of what you think in terms of your private practice setting. The second area I want to talk about is technology and telehealth. This is actually an area where we received a lot of advanced questions about, so clearly there's a lot of interest. And more patients are seeking new ways to receive care. In recent years, there have been a number of new apps and new technologies that allow practitioners to provide care remotely. In fact, today's patients, I think, are really looking for practitioners that provide them with options, whether it's by phone, online, or teleconference, and can best fit their individual needs and schedules. For example, I was at a meeting for NCQA last year where speakers were coming in and talking about advances in healthcare, and they were really focusing a lot on telehealth, particularly with millennial generations and younger generations comfortable using these types of technologies, but they're becoming to expect that this is going to be a way for them to receive care. And in fact, on the NBC News, World News last night, there was an entire segment about telemedicine, and that there were these kiosks being put into workplaces so that people can access, again, healthcare remotely. So even though this might be a little different from how we've conducted our practices in the past, or how we thought of ourselves and how we provide therapy, by finding new ways to reach clients, you can increase access for patients who need help. And I think we already know of a lot of the ways that telehealth can address these barriers to accessing care. Perhaps your client is looking to speak with you, but their work schedule won't allow them to meet in person. Or maybe they couldn't find childcare one day and they don't want to cancel their appointment, but they can't leave their house. So telehealth can offer some solutions to these different barriers. And I'll give you another example. There's an excellent piece in the September issue of the ABA Monitor, which talks about Dr. Sherry Benton, who used to direct the University of Florida's Counseling and Wellness Center, and she was really frustrated that the Wellness Center couldn't get to all the students who needed help. They had these huge wait lists. And so she started searching for programs that could help address this access issue. And she found some technologies online that allowed patients to have a brief phone conversation with the therapist, and then also use an online program teaching kind of more cognitive behavioral type strategies and skills. She was able to use this at the university, and it really took off. Students really enjoyed it. They were able to get a lot more care that they needed. It also allowed the university's therapist the ability to monitor students' progress by collecting outcome data. And then eventually, Dr. Benton, tailored this program to create her own business in 2015. Now, I'm not expecting everyone to go out there and become entrepreneurial psychologists who develop their online treatment programs, but I think that there is a lot of room here for psychology to take advantage of some of these opportunities as they relate to technology and telehealth. For those interested in learning more, my last slide which is going to focus on resources, will also have a link for guidelines for the practice of telepsychology that APA developed, which again would come in handy for those who are really particularly new or interested in this topic. The third area I want to focus on is wellness and prevention. As we talked about earlier, 75% of U.S. employers say stress is their #1 concern with their employees. So given that reality, companies are really beginning to develop wellness and prevention programs to help employees cope with stress, encourage work-life balance, and promote overall health and well-being. And in fact, APA has a lot of these programs. It really practices what it preaches, and I, as an APA employee and as an APA member, really appreciate that. While the jury is still out on the effectiveness of some of these programs, certain companies like Dow Chemical, Honest Tea, and Johnson & Johnson have actually found great success with their wellness programs. So I think there's a real need and opportunity for clinical psychologists to work closely with companies to bolster their wellness programs. Psychologists are the experts in behavior change. This is what we do. And so our participation could go a long way in ensuring these programs are successful. And there are different ways to do this. One would be maybe working directly with an organization that you contacted, create a relationship with. But I also have a friend who recently took a job with a private company, and they develop these health wellness programs and then sell these out to a variety of employers. So I think there are different ways to get involved. Another option, as mentioned here, is working in the area of prevention, which under the Affordable Care Act, these programs have been expanded in order to maximize positive health outcomes. So, as we know, early and focused interventions can limit the length and severity of mental and physical health symptoms and enhance functionings, particularly in children. And I think psychologists can play a major role in developing and enhancing programs that focus on wellness and prevention on the front end instead of just getting individuals on the back end when they're already sick or are dealing with a mental health issue. Of course, this is going to involve creating community partnerships. It might mean going out to the churches and to the schools and to other community organizations and really, again, being proactive in how can you bring your services to work collaboratively with them in order to reach the people that need the help the most. And then the last area is the area of program evaluation, in particular, developing outcome measurement programs. As psychologists, we're trained in the area of research and methodology. This enables us to measure the effectiveness of programs to show whether patients are improving. This is huge, right? And it's a skill set for which psychologists are uniquely trained compared to other mental and behavioral health professionals. It's our value add as psychologists. Under the Affordable Care Act, I'm sure many people are aware of this, but the healthcare system is transitioning away from a fee-for-service model, and instead to one where providers will begin to be paid based off the quality of their services. And in this system, hospitals will be incentivized to focus on patient outcomes, provide the highest quality of care, and lower readmission rates and costs overall. And so as the healthcare system begins to make this shift, psychologists have a huge opportunity to play a really leading role. Not only, as I mentioned, are we researchers and methodologists, but in many cases, particularly when it comes to mental behavior health, we created the measures that they want to use to measure outcomes. We know about reliability, we know about validity, we know how to create programs and then evaluate them. So I think we could play a huge role in measuring and helping to measure whether healthcare organization services are effective in ensuring positive patient outcomes. And again, this is going to be an area that psychologists, we also believe, are going to have to themselves be providing outcomes. But again, I think there's just a lot of opportunities for psychologists to assume leadership roles in healthcare organizations and make a considerable contribution outside the conventional therapy space. So there's a lot of information in a really quick period of time, and I was kind of rushing through because I want to make sure we have time for questions. But I also want to draw your attention to some resources. In particular, Practice Central, which is the website for the APA Practice Organization, which provides resources specifically tailored towards practicing psychologists. So on the website are a variety of resources, including information on innovative practice models, including co-location, IPAs, and ACOs, and then how to go about creating these relationships with other providers, other organizations, for advocacy and outreach. In addition, as I mentioned earlier, the link for the APA Professional Practice Guidelines, which are developed by experts and intended to be aspirational in nature, but can provide some real important guidance for those interested in learning more about the topics we've discussed today. In particular, I highlighted 4, telepsychology, which we talked about, prevention, working in healthcare delivery systems, and then also older adults. And so with that, I thank you for letting me speak, and I'll hand it back over to Garth for questions.
All right, thank you, Vale. We're going to turn now to the question and answer portion of our webinar. And again, I want to encourage our attendees to please submit your questions using the GoToMeeting chat function. We've had some submitted already. We've had some that come in earlier through the registration process, so we'll have a number to get us started. And we're going to try and get to as many of those as we possibly can. But to get us started on this part of the presentation, Vale, you talked a lot about how psychologists should get more involved in the healthcare sector. I particularly like the idea of leveraging technology in their practice and areas where you talk about bolstering wellness and prevention programs. And I think there's a lot of amazing opportunities there in the area of program evaluation. But what do you think are some of the biggest barriers for entry into these particular sectors? And I'm thinking more particular, how could, we had one question from an attendee who said they are currently a student. So I was trying to think of how do you think our attendees could leverage themselves, and maybe for those who are now in their early careers versus maybe who are in their more established careers, to try and make headways into these particular areas?
Yeah, I think that's a great question. And to be quite frank, the biggest barrier right now is payment and reimbursement. We just don't necessarily have the systems in place yet to catch up to where we see psychology going when it comes to these emerging career areas. For example, if you're looking to embed within a healthcare clinic, the only way to really make that feasible is likely to be salaried. And so that might require you presenting a business model to the clinic that includes a return on investment for your involvement, for the way that behavioral health can actually bring down their overall physical health costs. And so that might require either going and speaking with an expert to create a plan, or using some other resources like the Small Business Administration, SBA.gov, actually has different business models that you can look at on their website. And the other is, and again, this really exceeds to all the different areas, so including in telehealth. And while telehealth is clearly increasing, there is still a variety of different reimbursements and payment models. So certain insurance companies will reimburse for certain things and not for other things. And so that's going to require a little bit of work on your part to negotiate with your insurance company whether or not they're one of the states that actually mandates and allows you to bill for these type of services, and which services you can and you can't. So I think, again, being really well informed, knowing what your value is, and that could also mean going on to APA has lots of resources, particularly in the Center for Workforce Studies, on the value of psychology as it relates to other professions. So I think those are some of the ways, those are the barriers, and maybe some of the ways to overcome those barriers.
Excellent, excellent. We're getting a lot of good questions here, so I'm trying to move through them. I think one that would be really good to hear more about is how do you think this is going to happen? How do you think this is going to apply to those in rural communities? Or what about the type of services and the ways to branch out an emerging career into the more rural areas? We know there's lots of discussion and talk about healthcare and all kinds of medical services to people in rural communities. Where do you see this fitting in for us?
Certainly, I think the most obvious is in the area of technology and telehealth. When you are one of the only providers for miles around, telehealth becomes one of your few options in order for individuals to get really quality care. And in fact, some of the different private payer reimbursement models have rules around how far away a provider has to be for it to be reimbursed. So, there are actually a lot of ways that rural providers can really take advantage, and in a lot of ways the telehealth is geared towards those individuals specifically. But I also think that that these other areas are going to be important, again, but you might have to seek them out yourself. I mean, a hospital is not necessarily going to contact you to help create their program evaluation around outcomes. You might need to go to them. And that's sort of the idea that we're thinking about, is how can you reach out to others in your community, in your area, and not just sit back and wait for people to contact you.
And I imagine we have resources from through the APA and through some of the divisions and things like that can help people kind of think about those ways to reach out.
Yeah, absolutely. You know, to give another plug again to APA Practice Central, that's really where a lot of all of our practitioner resources are located. So there are tons of information and links about telehealth, articles and different ways that you can get reimbursement and the things that you need to know in order to be HIPAA compliant. There's an entire section about HIPAA compliance as it relates to both technology but other issues as well. So I really encourage practitioners out there who are looking for resources to go to ABA Practice Central, see what's there, see what you're missing, because it's probably a lot.
Excellent. We've been getting a lot of questions that roll around this idea of when you're breaking in this new career, how do you handle reimbursement? How do you determine what is fair pay? Do you have any advice or other resources or what's out there to help someone determine parameters for appropriate compensation
Yeah,
for trying to break into these new areas or when you're putting forth that first proposal?
Yeah, I think that's a really great question. So, you know, as I mentioned before, APA's Center for Workforce Studies does have some salary data as it relates to psychology. I would also encourage others to look at the Physician Compensation Report, which will give you additional information. You just go and Google it and find it, which is going to give you additional information about what comparable doctoral level positions in the healthcare field, what they're earning. It was interesting, I went online to another one the other day and psychologists weren't even listed. I mean, and that's sort of where we're at, right? I mean, we consider ourselves part of healthcare, probably many of us do, but others don't necessarily, and so they don't know what to do with us yet. And so again, being as informed as possible. Again, on APA Practice Central, there is a lot of information about how to maximize your reimbursement through coding. So that might be through using H&B codes or these other types of codes that maybe you haven't thought of using before, but could be really particularly relevant, in say a healthcare hospital-based practice. So it's not just the CPT codes that maybe you're used to billing. There could be other opportunities for billing codes that would make you, again, a really interesting candidate and somebody mental health that healthcare wants to include in their clinic.
Excellent. So we've been getting a number of questions up here about licensure and how this might affect, you might be licensed in one state and working with finding new opportunities, a company that might be, incorporated somewhere else, or of course with phone and telehealth, someone can call in from a different area. Is there anything to think about in terms of those regards as individuals are starting to think about how they can expand their careers into those areas, and what resources would be available for them to get more information about those so they understand the compliance and issues around that?
Yeah, that's another great question. So you're going to want to really be familiar with what your state licensing board, what their rules are. Many states have developed not necessarily licensing laws, but guidelines around telehealth in particular, what counts as telehealth, what doesn't, what constitutes, your ability to practice as a guest, for example, in another state if you're practicing telehealth. If your long-term client goes on vacation to Florida, can you talk to them via, FaceTime? Contact your state board. It might be that you can get a guest license in order to be able to do that for a certain period of time. With certain things that maybe fall more under consulting services, again, you're going to want to check with the state that, say, like the corporation example you gave, let's say the company you're working for is in a different state. You're going to want to follow up with their licensing boards to make sure that you are not practicing within their state out of sanction. And the other is, again, because systems are moving and those who are in regulatory fields are aware that we need to address some of these barriers. There is movement in that area. For example, ASPPB is working on an interjurisdictional compact. And so what that means is, just like the way that I can drive my car with a valid license in DC and Virginia and Florida, because these states all have agreements amongst each other that that's okay. the psychology regulators are working on creating a system where if states sign on that you could then join this compact and then you would be able to provide services, including telehealth services, across state lines while still being in compliance with your license.
Excellent, excellent. One of the things I think about as you talked about this and kind of moving forward, self-reflection seems to be an important part of our job. And how would you advise someone new to kind of think about their role in this, or some self-reflection aspects about these transitions and the value? I mean, it can be very challenging, and I think kind of maybe even a little frightening to have to venture out like this. So, what advice would you give to people, who are feeling that way?
Yeah, I think I would say take the advice that you would give your own client and how to self-reflect and think about changes. I think we all, I'll speak from my own experience. I went into a training model that was really geared to put you back into academia, and that didn't work out. Not for me, not in the way that I wanted it to. And so I had to really take some time and self-reflect and think about, well, what are my skills? Why did I want to go into academia? What is it that I want to do with this degree that I've worked several years towards? And what am I passionate about? And at the same time, how can I make a living? Because let's be honest, that's important too. We didn't go to school for 6, 7, 8 years so that we could not be able to pay our bills. So I think there's always room for self-reflection and asking yourself the tough questions that you would ask your own client or patient if they were coming to you with a similar issue. Let's use those skills that we've learned for good. Let's use them on ourselves. There's no reason why we can't ask ourselves, what's getting in the way of me taking this step forward?
Yes, I think that's a really good point. I think to some extent there's also maybe some feeling that there's I don't want to say safety in numbers, but take console in that we aren't the only group that's facing this, or it's not just in this parapsychology. I mean, we've been doing these careers, we've been doing these seminars across the entire discipline and profession, and so we've been talking about how academic research is changing. And so there's individuals who are doing the same thing. How do they reposition themselves, or how do they broaden their impact to ensure that they have a new and exciting and rewarding career? So I think also there's a group out there across the entire discipline, also within the profession, that can serve as like a community of resources. So I liked that story. I wonder if you could tell a little more about that opportunity you had to go get retraining, because I think sometimes people are hesitant about that. And are there other types of opportunities where it's, it might not be going back, and don't think of as going back to school full time, but an opportunity to try and get some training, either it's very formalized or in a kind of informal way, to get some skills and to become more familiar with these new emerging fields and opportunities, so that you kind of can see an easier pathway. Are there other opportunities that you could talk about like yours, or could you talk a little more about, even though it didn't work the way you wanted, it still helped you kind of come to where you are now?
Yeah, I like I mentioned, I had a very set idea of what I thought was going to happen after I completed my clinical internship, and that was to go in academia. And when I sort of realized that wasn't happening, and I kind of mourned that a little bit, I thought about, well, what is it that I think that I need to position myself in the best place possible so that I can, really be marketable for different jobs. And so that, for me, required taking a 2-year postdoc. It wasn't really part of my plan, but taking a 2-year postdoc allowed me to get hours towards licensure, and it allowed me dedicated research time to increase my publications. And it was in Akron, Ohio, and if anybody is online here from Akron, I apologize, but it wasn't exactly where I expected to spend the next 2 years of my life. So I think sometimes we do have to make hard decisions and think about, in the long term, what's really going to work out for us. I do think there's a lot of opportunities to, not necessarily like you mentioned, get retrained, but to gain the skills that you need to gain. So for example, we do have the resources I highlighted before on APA, but also there are so many CE opportunities and networking opportunities, and I would encourage people to attend conferences of the area they're interested in, even if it's not necessarily their niche conference, right? If every year I go to, say, ISTSS, which is the trauma conference, it's great. I get to see a lot of people I know, and I'm probably going to hear a lot of talks about stuff that I pretty much know a lot about. But if I really encourage myself to, say, go to my state psychological conference, I'm probably going to meet new people, be exposed to some different ideas, and that's going to actually help me move and maybe in the direction that I want to go. So it's sort of thinking about how can you challenge yourself to get the information that you need.
Excellent. Well, I have to say I laugh because I grew up just outside Akron, Ohio, so sometimes I can see exactly what you were talking about. I do love where I came from, though. Well, thank you very much for joining us today, Vale. I think that's all the time we have, so we're going to have to wrap up, and I want to thank our listeners for the participation today, and I hope they found this helpful. Those who are, who have registered and are part of this, you will receive a recording of the webinar and the slides, so we'll have our pictures and information at the beginning, and it will have links to the resources. It will take a little bit for the APA offices to get that set up and sent to you, but look for it in your email, so it will be coming. I also want to ask those who are participants to make sure that you stay on as soon as we get off. After the webinar has ended, there's going to be a short survey that appears. We really do hope that you'll take a few minutes to complete this. It not only provides us feedback on the entire session, but we can use it to also think about what we want to do in the future, whether kind of webinars would be helpful, and how we can improve. So with that, I want to thank everyone for attending. Remind them this is part of our PsychIQ series, and there's other resources that we have available through all the different APA resources. And I want to thank everyone for coming, and have a wonderful day.